As a pioneer and innovator, Dr. Langer is responsible for training top academic surgeons who now work all over the world. That has allowed his inspiration to ripple through generations and now motivate me to pursue a career in surgery.
Bernard Langer was Toronto born and raised, and medicine was not on his early years' radar.
I initially thought I might be a mechanic. I always loved to tinker with things, take the clocks apart, take my bike apart and put it back together. I had to know what make things work. And my older brother talked me out of that. He thought I ought to go to university. Found an athletic niche in swimming, so I was a competitive swimmer, and I did that in university as well. I applied to medicine, and I saw my future as a family doc, like our own family doctor. And off I went. And it wasn't until my final year that I worked on a surgical service and became just absolutely in love with being a surgeon. I loved to see what made things work, and I loved fixing them, and that looked like it was a career just made for me. I visited a number of cancer centers and spent 3 months as a fellow at the MD Anderson Hospital in Houston. And then I did an additional 6 months at my request in Boston at the Peter Bent Brigham Hospital, working for Francis Moore. When I came back to Toronto, I had a real interest in changing the way research was taught and done by surgeons in Toronto.
One of the first things that he achieved was the development of an income sharing agreement, a practice plan whereby incomes were shared across the members of the Division of General Surgery, and that allowed him to create a culture of subspecialization within the Division of General Surgery.
He introduced practice plans which allowed subspecialization, and I think that that has gone a long way to develop real expertise.
He basically established the subspecialty disciplines of vascular surgery, of colorectal surgery, of surgical oncology, of hepatobiliary surgery, and of transplantation within the Division of General Surgery.
Probably the most profound and sustained one was his development of the hepatobiliary transplant program at UHN, or I guess Toronto General in those days. Basically that started under his direction. I think it was his brainchild.
And we did our first liver transplant in 1984. And it is one of the largest transplant programs now in the world.
And I think that obviously what we see today, which is a world-class transplant program, a world-class hepatobiliary program, is one that he basically conceptualized.
By introducing practice plans across the entire Department of Surgery in the city of Toronto, he was able to establish the Surgical Scientist program and take Toronto from not just being a center of clinical excellence, but also being a center that promoted academic and research excellence.
The Surgeon Scientist program has actually become a model program for research training in Canada, and specifically training of clinicians to pursue a career as a clinician or physician scientist.
When I was at the Royal College, we also introduced a new training stream called the Clinician Investigator Program, which is modeled on the Toronto Surgeon Scientist program. And that now has been taken up by almost all of the universities across the country.
He has trained a whole generation of surgeons, both here in Canada as well as worldwide. And I think with that, he leaves a big legacy.
To date, there have been over 70 fellows have graduated from Bernie's program, the program that he started in the 1980s. And so he has sown seeds of academic excellence throughout the world.
The benefits that we see in Ontario now as a result of Dr. Langer's leadership, of course, are also having a ripple effect in Canada and across the world that will have benefits for generations to come.
I don't think there's anyone like Bernie in terms of having a vision, and he thinks of these things long before anyone else has thought about them.
Bernie always put family up front. You know, if you talk about Bernie, you're talking about Bernie and Rhina, because they were basically the consummate team.
On the personal side, what I'm most proud of is my family. My wife, who has propped me up for over 61 years in our marriage, and our 4 children, who are absolutely amazing, and 10 grandchildren.
And I'll never forget the day he said to me, "If you don't stand tall enough, you won't see far enough." Bernie stood very tall, and he took us very far.
A world pioneer in HPB surgery, a prolific trainer and mentor, and a visionary developer of the Surgeon Scientist program. Canadian Medical Hall of Fame laureate, Dr. Bernard Langer.